Across the United States, a heated debate is emerging over childhood vaccinations, a pillar of public health that has nearly eradicated diseases like measles and polio. Once a matter of routine, vaccine decisions are now at the center of political and public scrutiny, with trust in science and institutions being openly questioned. Parents face a confusing landscape, bombarded by conflicting information and political rhetoric. The debate now extends beyond medical facts, touching on personal freedom, government roles, and institutional trust. Routine pediatric visits have become battlegrounds for these larger issues, leaving families uncertain about whom to trust. The choices made in this climate could reshape public health for generations. As we explore this controversy, understanding the key players and the stakes has never been more urgent. At the core of U.S. vaccine policy is the Advisory Committee on Immunization Practices, or ACIP, a panel of experts under the CDC. Their job review scientific data and recommend which vaccines should be part of the national schedule. ACIP's guidance shapes what doctors recommend and what insurance covers, making their decisions critical for millions of families. Historically, ACIP has been respected for its scientific rigor and independence, rarely drawing public attention. Their recommendations are more than guidelines. They determine access to vaccines, with insurance required to cover what ACIP endorses. This process has made vaccines widely available and affordable, protecting public health on a national scale. But as trust in institutions wavers, the committee's authority is now under the microscope. The future of vaccine policy may hinge on whether ACIP can maintain its scientific integrity amid growing scrutiny. The ACIP's authority is now being challenged at the highest levels. Senator Bill Cassidy, a physician and Senate Health Committee chair, has publicly questioned the committee's integrity, echoing a broader skepticism toward scientific institutions. Some newly appointed ACIP members have even voiced doubts about established vaccines, fracturing the committee's traditional unity. With the ACIP set to review recommendations for 3 key childhood vaccines, the outcome is being watched by politicians, doctors, and parents alike. The core question: can ACIP remain a science-driven body, or will political pressure reshape the nation's vaccine policy? 3 vaccines are at the center of the current debate. The COVID-19 vaccine, the long-standing hepatitis B shot for infants, and the MMRV vaccine, which protects against measles, mumps, rubella, and chickenpox. Any change to these recommendations could have major public health consequences, especially for diseases like measles that can quickly resurge. In a rare move, major health insurers have pledged to continue covering these vaccines regardless of ACIP's decisions. This commitment aims to ensure families retain access to essential immunizations, even amid political uncertainty. The insurance industry's stance highlights the gravity of the situation and the fear of a potential public health crisis. Their proactive approach provides a safety net for parents and pediatricians, but it also underscores just how extraordinary and unsettled this moment is for vaccine policy. This debate isn't just political, it affects every child's health. High vaccination rates have built community immunity, protecting the vulnerable and preventing deadly outbreaks. Weakening vaccine recommendations could erode this shield, risking the return of diseases once thought conquered. Parents now face anxiety and confusion, caught between medical experts and political voices. Vaccine hesitancy grows when trust and clarity fade, threatening decades of public health progress. The decisions made now will shape the health of the next generation. Vaccination remains our most effective tool for disease prevention. As the debate continues, the stakes, children's lives and public health achievements, could not be higher.